All right, so good morning, everybody. I'm David Lowe. I'm the head of the Breathe Center. I want to welcome everybody. It's so great to have such a great assembly for this great workshop, even though we have these challenges with the campus shutdown. As you all probably know, 5 years ago, we started the Breathe Center as a interdisciplinary center for the study of air quality and health. And in fact, some of our speakers today were actually hired under the cluster proposal that was part of the Breathe Center. So this is actually now our third annual research workshop. And this one in particular emphasizes the really, truly interdisciplinary nature of the center. The work on air quality and health effects not only incorporates research across disciplines, but also extends to the conceptual issues, the important questions of health disparities, as well as environmental justice. And I hope that the discussions today will broaden that conversation into these important areas so that people will help get those kind of broader perspectives, even for those who are doing more focused laboratory research and so on. We have an important research collaboration with the Center for Health Disparities Research, which is led by 𝘠𝘰𝘥𝘪𝘁, who's our first speaker, and as well as myself. And this collaboration is also providing significant material support for the cross-disciplinary research studies. So again, welcome to you all. I will now pass the baton to Will Porter, who, along with Emma Aronson, assembled a really fantastic series of speakers today. And then we'll have a moderated panel that Bronwyn's gonna lead. And hopefully we'll have a very interesting panel discussion following the talks. So I'll pass this on to Will, and again, welcome, and I hope you enjoy the discussions today.
Thanks, David. And I'm going to keep things fairly brief, aside just from thanking you all for being here. It's my pleasure and honor to introduce our speakers. I think we've got an excellent group of speakers and panelists. I'm looking forward to participating. And our first speaker today is going to be 𝘒𝘊. Dr. 𝘱𝘊 is a professor of environmental economics and policy in the School of Public Policy, also the associate dean of the School of Public Policy. And his research focuses on economic issues associated with water use, agricultural production, urban water conservation, ecosystem services, and environmental regulation. And so, Dr. 𝘱𝘊, you're on.
Thank you, Will. Let me pull up my screen here. I think I have screen sharing and view. All right, oops. Okay, it's been a success so far. I'm going to stop. Thanks, Will, David, Emma, Juliet, for putting this together. This is obviously very timely. Thanks to the whole Breathe cluster for putting this together and engaging in such timely and important interdisciplinary research. So today I'd like to talk about three things. First of all, kind of a framework that I use as an economist when I think about public policy issues, especially environmental and natural resource issues that affect society. And the reason for this is I think if this kind of framework, a benefit cost framework, I won't spend much time on it because I don't want to go take you all back to Econ 101. But I think if this framework was applied back in 2003 or 2001, around that time when the QSA was being developed, I think probably there would have been less environmental justice issues because I think this framework, when applied, naturally identifies that kind of impact in terms of who has standing in these types of issues. So I'll present that somewhat briefly. I'll talk just briefly about kind of what the kind of the most widely used or cited benefit cost analysis studies to date is, the limitations with it, and then identify some of my own research that looks at health disparities, and the environment. So as you see on the right there, you see that benefit cost analysis is a systematic categorization of the impacts as benefits and costs, valuing in dollars. It's just an easy way to compare things in terms of how we assign weights, but you don't have to use dollars. You can use other metrics if you want. And determining the net benefits of different proposals. So the net benefits in economics can be defined as total benefits less total costs. But the framework is useful, not only from an economic viewpoint of coming up with kind of what we consider the solution that provides the largest net benefits, but it really adds transparency. And that's really why I like to kind of promote this framework in terms of not only do you get an understanding what kind of the impacts are as we can measure them, identification of the uncertainty and the trade-offs, but it also talks about who gets counted. So if you apply it correctly, you have to talk about who gets counted, what gets counted, and how it gets counted. And today's talk is about that, often undercounted and non-represented impacts or people that are not included in these analyses or these policies. So that's where I kind of think the benefits are with benefit cost analysis. It's a transparency issue from my perspective. So if we talk just briefly about the kind of steps, I'm not going to go into much of this, but step one is really determine who matters, whose benefits and costs count. And I remember, early on in late 90s, early 2000s, up through about 2010 or 11, no one ever talked about the disadvantaged communities around the Salton Sea. Even though, we presented this paper and this approach back at a conference in 2002 or 3. And if they had taken this approach, I think that, the concerns that the local communities have regarding health would have risen to the forefront, especially through focus groups and such. So, it's important to determine who has standing, and this approach gives you that. It's also looking at the selection of the portfolio of alternatives to evaluate. So compared to the status quo. So if you ever go back and look at kind of the evolution of the QSA and the mitigation strategies, you see that they're very narrow, right? And they don't look at a lot of the environmental impacts or health impacts. And again, this is something that when I looked at it back then, I said, hey, wait a second, there's a lot missing here. But obviously I was just an assistant professor, I had no bearing on anything. So no one listened to me back then, but it's an approach that I'll still push. Then you catalog the physical impacts and select the measurement indicators. And this is where I see the BREATHE cluster and the EDGE Institute under Marilyn Fogel. They're really starting to do this, at such an amazing and impressive level. Whereas back, 20 years ago, 30 years ago, there wasn't a lot of information on this, but you need this type of information to understand what the most effective, efficient, equitable, and sustainable solutions are. So it's really good to be part of these groups. And then I'm not going to go through these other ones very in much depth, but then you look at it over the lifetime, you monetize it. To some extent, these are anthropocentric values, right? For values that people care about, which doesn't mean that, you care about sustainability and non-use values and things like that, but they are anthropocentric. And then, oops, the last slide, hold on here. And then you have to discount it. So, it's a good approach to talk about, well, is $1 today the same as $1 in 2047 when the QSA ends and can get renewed? And so it gives you an opportunity for comparing benefits and costs over time. You sum it up, which when you sum it up, you actually can sum it up across different groups too. So in this case, you can look at both efficiency issues and equity issues. Who bears the costs, who bears the benefits? And often you see, especially in a lot of the development work that I've done, like with forest management and such, is that the locals often bear the costs and larger groups, maybe politically powerful groups, often bear the benefits. So this is an approach or a framework that allows you to identify that systematically. And with any type of analysis, you always want to perform sensitivity analysis because you're always dealing with uncertainty and everything. So you want to see, what levels of uncertainty seem to matter, how you're measuring, say, air quality. Are you looking at dust from agricultural fields? Are you looking at what's coming off the sea? So you're doing sensitivity analysis when you're trying to say what's really driving asthma rates, et cetera. So that's an important part. And then the last step is to recommend or inform. So I always kind of think my role isn't to decide, obviously, it's to inform, and it's one piece of the puzzle in which the policymakers should make a decision. So kind of the summarized benefit cost analysis, this framework, it's not easy. There's many limitations. Sometimes you have to hold your nose a bit. It can be controversial. For instance, what's the value of a statistical life? I think that it should be included in analyses. If you don't, you're treating it often as having a zero value. But it is a public policy issue, and basically most economists, nearly all, will agree with it. It's useful because it adds a systematic framework and transparency for understanding the overall impacts, the trade-offs, regardless of whether you measure it in dollars and you want to choose out some other metric. It gets at who gets counted, and it gets at what gets counted, and how things get counted. So, and also highlights uncertainty. So just a plug for, as economists, typically when you come into a problem, we think about these, and then you break it up in terms of what needs attention now. And so, today's kind of talk is, well, the health estimates really need a lot of attention. They've been overlooked, especially the health impacts on more vulnerable communities. And interestingly enough, if you kind of look at the most widely cited numbers on the Salton Sea in terms of the impacts of doing nothing, you look at Cohen's work in 2014, and it's from a paper or report he titled "Costs of Inaction at the Salton Sea." And so what he did was basically said, what are the costs, the state's thinking about in terms of mitigating, revising the Salton Sea? And those are the two black bars at the top. They come to be around, back in 2007 when they looked at this, they said, it's about 10 billion in capital costs and about 150 million in annual costs over time, through 2047, let's say. And this is what people anchored on, $10 billion. How can California afford to spend $10 billion? And that was the only number that was out there. Now you talk to the ecologists like Tim Bradley or other people early on who were working in the Salton Sea, or if you went out and you interviewed, people around the sea, they would say, wait a second, there are real damages going on here. But that wasn't getting into the calculus here that the policymakers were considering. They had this one number, 10 billion, that's a big number, we can't afford it. Well, what Michael did was he kind of pieced together a lot of different studies that looked at different elements of what are the damages of doing nothing, right? And so he comes up with the public health, property impacts, ecological impacts, etc. The ecological impacts he pieced together from some research that Ken Berenclaw and I did in terms of looking at non-use values and use values. But the big one there you can see is the public health impacts, and you can see those really dominate everything here. So when you account for all these the damages, you come up with something between 11 and 70 billion dollars, and through 2047. And so that gives it kind of standing. And so when people start talking about, well, it's going to cost $10 billion, to revitalize it, the counter now is, well, it's going to cost 11 to 70 billion if you don't. And so I think that's a really strong argument for thinking about, sure, revitalization costs money, but not doing it also costs money. So it was a really good and timely study at that point. It should have occurred basically back in 2003 or even earlier. So I'm glad Michael took that up and put it together. And now we see David Lowe's group and Marilyn Fogel's group, they're actually coming up with kind of these great emissivity rates, these latent transport functions, the impacts on health, the different types of impacts. So you can actually measure these impacts more precisely. So this is kind of what Michael did, was kind of a first swipe using really kind of outdated data, 20 to 30 year reports in terms of the public health. And so this is great being a part of such timely research. And so one thing Michael was always good at was talking about the limitations of the analysis. And there are just too many items to go through here. But if you go to his analysis and his report, you'll see that many of these limitations, the Breathe cluster and the EDGE group is focusing on, which is necessary to develop fair, equitable, efficient policies that the lawmakers can consider policymakers. So it's slowly changing. The data is coming in, addressing these limitations, and I have to say that most of it is happening at UCR. So it's exciting to be here and amongst such wonderful people. So now I'd like to shift to just an example of kind of a research project that I'm doing right now that looks at health impacts and to some extent some equity issues. And so it has to deal with drought. And so if you look at that table in front of you there from Lund, what's interesting is when the state considers the impacts of drought, if you just go through those impacts, you see herds and crops devastated, devastation, salinity, crop loss, urban water shortages, so what we're putting on our lawn or what we're using inside, endangered fish and agriculture and fish, etc. And so they have information, right? And this is important because when they look at the impacts, what they do is they develop policies to address the impacts that rise to a certain level, right, in terms of politics and such. Well, so what you see is that they understand the survival rates of juvenile fish, which is good. They understand the impacts on how much people in Beverly Hills perhaps water their lawn, and they understand the impacts in terms of how much crops will be fallowed in the Central Valley. And in a sense, that's water policy is really is focusing on those impacts. What you don't see is anything related to health there. And the importance of this is that health, especially if you think about, and the focus of our study is on mental health and birth weights. is that these are long-term costs, right? Whereas if you fallow a field one year, you start growing it the next year. It's an annual crop. It's a perennial. It's a little bit different. But a lot of these impacts are annual or very transitory impacts. And so you don't see health on here. So we, through my travels through the Central Valley, when you start talking with people up there, the farmer groups and such, you start to realize that during the drought, while California didn't really suffer a big impact, overall relative to kind of statewide GDP, it was really concentrated in certain areas. So we wanted to look at that. So we got a Robert Wood Johnson Foundation grants under the Evidence for Action program. It's a very interdisciplinary group. We have Bruce Link and Mindy Marks. Mindy's a labor health economist. Bruce is a sociologist. The person who did most of the work here is the postdoc 𝘰𝘰𝘥𝘪𝘐𝘐 did an amazing job in terms of the analysis. And so kind of the two questions we asked were, right? So the first one is, how do random variation in extreme weather events, and that was our proxy for drought, our first swipe at drought, how do they impact health? And we're not so concerned right now with the mechanisms, whether it's an economic mechanism or an environmental, some type of biological system mechanism, et cetera. We want to see, do random variations in extreme weather events have these causal effects on birth weights, on psychological distress, on self-rated health, et cetera. And then once you look at that relationship, and we do find relationships, which I'll go into briefly in just a second here, we want to say, how does water policy mitigate or exacerbate those impacts? So the connection here, and again, going back to kind of the Central Valley, you go down the Imperial Valley, is that these primary industries are really highly reliant, especially agriculture, on water. And so how does water policy, how do water allocations get determined? And over time, they're malleable and they change. And if there's no impact or no information on the health impacts in certain areas, then that gets a zero value likely in terms of thinking about how we should change water allocations. And so what we want to see is, does water policy in terms of who has the seniority rights and who doesn't seem to mitigate that climate health impact. And so to do this, we collected a bunch of data. We have 11 million observations, birth weights in California from 91 to 2011. So if you were born in California between 1991 and 2011, you're in our data set. We have 350,000 observations through the California Health Interview Survey in terms of using the 𝘂𝘋𝘕 measure for psychological distress. And then we collect environmental data. We have over 800 weather stations throughout California from 1990 to 2015. And we develop, daily maximum, minimum, daily precipitation totals. We use to look at the Palmer Drought Severity Index. And then we get information on water policy data in terms of water allocations to different irrigation districts and water districts throughout California. We use a very kind of the workhorse these days within econometrics or economics. We use a fixed effects ordinary least squares approach. And to some extent, what we're doing is controlling for other factors that affect health. We look at how random variations with extreme weather events, extreme temperature, whether they impact mental health or birth weights, and how water policy mitigates that effect. We control for a lot of other variables, as I said. We have the outcomes of birth for the birth weight analysis is birth weights and gestational age. And then we account for all these different characteristics, as you can see on the left-hand side. I don't have enough time to go through all that, but maybe we can post this, Will, after the presentation today. But we control for what factors that you think would be correlated or confounding effects on health of newborns and gestational age. There's our estimating equation up there. And then weather stations. There are all our weather stations throughout California that we have daily data on. So it really took a large computer to process all this data and run our results. And to some extent, just briefly, the two slides on the outcomes. So first of all, with regards to newborns, the slides on the left are basically the point estimates for different temperatures. What are the impacts of those bins on health? So if it's below zero, that means it's an inverse relationship that that birth weights go down. And what we see, and the outside lines are 95% confidence intervals. And what you see is the largest impacts are between 80 and 90 degrees in terms of the weather for this second trimester and third trimester. And so kind of to summarize the outcomes, we have hot days reduce birth weights. Hot days also shorten gestation. Hot weather reduces birth weights more on unseasonably weather. So in wintertime, a hot day in the wintertime has much more of an impact than a hot day in the summertime. More robust impacts occur in the second trimester. You also observe some impacts in the third trimester. The impacts are greater in the agricultural areas. So this gets at kind of the motivation originally for my research, is the agricultural area during the drought took the brunt of the beating. And so we see that the impacts were greater in agricultural areas. And then we also saw that in the agricultural areas, those with less secure water rights had a greater impact. So lower birth weights in areas, agricultural areas with less secure water rights. So it gives a reason for a particular policy change or a policy acknowledgement or recognition there. The other element we looked at was psychological distress. Kind of the punchline here then is that what we find is that it's not necessarily one-time events, it's heat waves that matter, which is something that's somewhat unique to this research. And not only is it heat waves that matter, but it's heat waves that occur at night. So to some extent, you kind of think about you're a battery going out through the day, you can get drained through the day, and at night you want to kind of build up your health again, charge up your battery and your health. And it's that nighttime exposure that really seems to matter. So we looked at daytime and nighttime, and daytime didn't matter as much, but nighttime certainly mattered. I won't go into the details in terms of the percentages, but we didn't detect any difference between, by gender or age, but we did detect the difference, and this gets at the equity issues in terms of poor communities, poorer households were especially vulnerable to the impacts of nighttime heat waves on their mental health relative to more affluent communities. And so that was the result of that. So kind of to conclude then, benefit cost analysis provides a useful framework to compare policy alternatives. I think it's great in terms of just the transparency that it demands. You can enumerate the impacts, you can identify the trade-offs. The solvency management strategies have been narrow and poorly informed, in need of evidence and more science, and I think that's happening on campus, and it's finally finally starting to make its way to the policymakers, which is great. And then extreme weather events with regards to my own research and drought can impact birth weights and mental health. Rural areas and poorer communities are more vulnerable, but policy can play a role in prioritizing vulnerable communities, mitigating impacts. The last slide then is there's some other research that I'm involved in that, think about that. The idea here is interdisciplinary research. One project's looking at manganese contamination and health disparities. It includes Sam Yang, Bruce Link, Mike Lee, again, and Cassie Guarino. Water affordability, myself and 𝘱𝘵 𝘠𝘠𝑚𝑎𝑑𝑖 were looking at, to what extent do water costs burden low income and disadvantaged communities? And then also the state right now is considering a low income water rate assistance program. And my thought is, what is the impact on health there? There's really no objective measures of how these low income rate assistance programs work, what impact they have. And, we have the outcomes, we have health outcomes that we can actually evaluate these. So I'll stop there. Hopefully I didn't go too much over time. Well,
no, that's fine. Thank you. Virtual applause. Very nice. Sorry about that. Thank you, Kurt. That was great. We started a little bit late. We've got some virtual applause going up. That's wonderful. We can do a little bit of Q&A here. If you have the chat box open, you should be able to raise your hand if you have a question. So if you do have a question, feel free to put up a request, and I should be able to see that in the sidebar. We'll also, of course, have a chance to hear more from our speakers for the panel discussion after. So if there are no questions, we can move. I actually had one question. Oh, wait, I see a question right there. Kathy Eiler, you are on. Go ahead.
Hi, everybody. Hi, Kurt. Thank you so much for that really informative presentation. I wanted to also suggest, I know we had talked before about doing a congressional briefing on the Salton Sea, and now it looks as though we need to do that virtually. So I'll follow up with you offline on doing that, because I think your presentation is critical, especially now with the results that you have. I think it'd be really important to share. So thank you.
Thanks, Kathy. Yeah, and if other people have other questions, don't hesitate to send an email to me about anything that I've talked about today. Thanks.
Great, thank you. And I think with that, we'll move on. Thank you, Kurt. Our next speaker is Professor Juliette McMullen. Professor McMullen is a professor and chair in the Department of Anthropology, and her work focuses on the production of health knowledge and inequalities. So it's my pleasure to introduce Professor McMullen, and you have the floor. Go ahead.
Good thing I didn't get through too much of my talk before I realized I was muted still. So thank you, Will and David and Emma, for organizing this really interesting panel. I know Will knows that I had a little hesitation. I don't do environmental justice, but I would say that the project is aligned, and particularly since we're talking about health equity and equity just in general, there are some nice overlaps. I also want to provide a land acknowledgement for a lot of the area that we're talking about, the ancestral and current caretakers, the 𝘒�㫭𝘭𝘪𝘳𝘏, 𝘂𝘰-𝘧𝘦𝘴, 𝘬𝘰 and 𝘂𝘰 peoples. And then also, since I'm coming to you from Orange County, I want to acknowledge the 𝘗𝘰 people for allowing me to be a visitor on their land. And as we go through the presentation, you'll see why those kinds of land acknowledgements are critically important for our histories and the way that I think about what we're doing. So the project that I want to share with you today is a community collaborative project. So there's a bit of methods that I want to talk about, and then I also want to share some of what we did and what we found out through this project. So the project is 𝘰𝘭𝘪𝘐𝑰𝑛𝐻, which is Serrano for a gathering of good minds. And even from the start, when we thought about the project, we went to some of the elders and asked Mr. Ernest Siva what we should even call our project. So our name was a gift to us from Mr. Siva, so we want to acknowledge that. One of the interviews that I started as we were going through the project was with 𝘱𝘂 Milanovich, and we were having a conversation about the Temecula Treaty, which is a treaty that was signed by the tribes down in Temecula in the early 1800s after a horrible massacre of so many of the indigenous population. Even to find out then, after the treaty had signed years later, that the Senate never actually approved the treaty. So there was a lot of bloodshed and conversation that never made its way through policy. But before I started that conversation with 𝘱𝘂, he wanted to open with a bird song. And after he finished the song, I asked him, what's the importance of this? And he shared that it was really important for him to open any gatherings with the bird songs because it acknowledges the land, the people and the birds that are occupying the land and your relationship with them. It's also important for blessing the moment, acknowledging again the connections to the environment, acknowledging the migrations of the birds, which often followed the migrations of the people as they were gathering food and supplies and needs for life. And it also showed their history, their identity, and their responsibilities and their obligations as caretakers of the land. So when we came together to talk about health and the role of the treaty in health, it's never just about physical bodies, but rather it's about relationships. It's about histories, geographies, our families and our communities, and our obligations to care for each other and the land. So the project that I'm going to share with you, the Gathering of Good Minds, this adapting a historical trauma curriculum is actually our second project that we had that was funded by PCORI, Patient-Centered Outcomes Research Institute. And the first project that we collaborated on was a series of talking circles. For over a year, we held talking circles at different clinics to really figure out what it was that the people wanted to talk about, what was important to them. So we had a series of project leaders from mostly Riverside San Bernardino Indian Health, but also tribal members. And then we have a steering committee with that. So everything that we do throughout the whole project is this process of our leadership team coming together and talking, and then talking with our steering committee, and then bringing it out to the community and getting more information about what needs to be done. And so after that year-long conversation, what people really wanted to do was to have more information about historical trauma. And so one of the doctors on our group suggested that we actually make a curriculum for the providers, because oftentimes when physicians come to work for Riverside San Bernardino Indian Health, they have no training. They know nothing about Native people. They know nothing about the histories. They just come in as regular physicians and are put in in a care situation with vulnerable populations. So, the need was to really share more of the history of the Native people, and that we wanted to, while we sort of looked around nationally, we wanted to focus it on what was going on in Riverside and San Bernardino. So Riverside San Bernardino Indian Health is actually a consortium of 9 of the 12 tribes. Well, sorry for the digitization on this, but anyway, it's a consortium of 9 of the 12 tribes that are right up the freeway from campus. And they are funded by the tribes that are in the consortium. So some of the money comes from Indian Health, but it's not actually appropriate to say that it is an Indian Health Service. The tribes came together to create this health system because there was such a lack in the communities. And so they started around 1970. They just celebrated their 50th anniversary, which was really exciting. So in the service area of Riverside San Bernardino Indian Health, they have 7 clinics ranging from Barstow all the way to Torres Martinez. When we talk about Native Americans, we often hear all the high rates of disease. So high rates of diabetes, high rates of cancer, cardiovascular disease, now COVID-19, having some of the highest rates there as well. But we don't often hear about why. Like, why do they have all these high rates? It's often put off as like, well, they don't have the right health behaviors, and it's an individual problem. And so to address the problem, we need to create interventions that help people to eat better, rather than thinking about the larger context and the histories that actually create the situation where Native Americans have these high rates. And because of the way that our history has been overlooked, and because so much of it is individualized, there's a lot of mistrust in the communities, because there's really no reason why they should talk with us researchers or trust us to really understand what's going on and do anything about it. So, oftentimes we talk about research fatigue. So people are just tired of being researched all the time, and none of the data, none of the information actually comes back to them. So part of this community engaged work was to develop the question in partnership with our community, to decide how we were going to do the work, how we were going to train people to build capacity to help us do the work, or not help us, but to collaboratively do the work all the way through the project, and to really address the kinds of needs and disseminate the information in a way that was a collaborative decision with all of the group. So what is historical trauma? There's a significant and growing literature around historical trauma and soul wounds. Often it's related to spiritual injury around the soul wound, events that happen in history that cause such immense pain and suffering, like genocide, physical and cultural, that it's carried through generations, generation after generation. So it stays with people. And oftentimes when we talk about historical trauma, people think It's something that happened in the past, and it doesn't have any relevance to what's going on today. But we continue to see the events, the same historical events going on today. So, you know, the Keystone Project, the Pipeline Project, and also still today we see children being taken away from Native families and put into foster care or put up for adoption. One of our colleagues was sharing that Riverside actually has one of the highest rates of taking children out of Native families. So we're not talking about something that happened before. This is still happening. One of the things about the literature, the historical trauma literature, again, is that it still defines it in psychological terms that affect physical health. But when we look at the reasons for historical trauma, so explicit policies designed towards physical and cultural genocide, economic impacts, so the loss of environment, when you take people off their land, put them on reservations, they're not allowed to go around and gather the foods and have the same kind of subsistence, which affects their health. And so you put in commodity foods, which was not good food. We had people talking all the time about 𝘠𝘠𝘭𝘪𝘐 and the big barrels of peanut butter and canned food and cheese, all these things that increase weight, right? So the loss of economic, the ability to have economic livelihood through the loss of environment. Reservations, again, it cuts people off not only from their environments, but it cuts people off from family. So people weren't necessarily put onto reservations because they belonged to one specific tribe. They put different groups and different families and clans who wouldn't have normally lived in the same place. They just put them all together in this one area and said, you need to stay there and figure out how to survive. Boarding schools were another huge area, and that was a direct attack on Native families, taking children out of families and putting them in institutions where, you know, that we all know that saying, kill the Indian, save the man, right? That was the direct intention of boarding schools. And then also forced relocation during the termination period. So around the 1950s, the United States decided that they did not want to honor the treaties that were signed and get out of the business of supporting Native Americans and reservations. So they started having people move out of the reservations. And, you know, that has a double effect then again on all the cultural systems that were being built up and shared during that time. So there's all these policy, economic issues at play here that give rise to the historical trauma. So it's not just an individual problem that Native people can't cope in this in a capitalist environment, although I don't know that many of us cope very well in a capitalist environment, but you know, this is a structural problem with policies designed to support poor health. So our group, our leadership team kind of went through all that literature together and started talking about it, and they kept on trying to remind me and our other researchers on the team that that not everyone experiences historical trauma in the same way. So for example, we had one person on our group that had gone to the boarding schools, but she had gone much later as high school, and it was one of the best things that had happened to her because she got more education, she became a nurse, and you know, it was a very different experience than the kinds of traumatic, abusive experiences that you normally hear of very young children being taken away. So they wanted us to always remember that when we went out to talk to the groups that we weren't treating everyone exactly the same. Because we were talking about trauma, maybe people wouldn't talk to us, honestly, because it, you know, it takes years to work through that. And then also to think about the meaning of trauma for people. So again, not putting the people that were sharing with us in boxes. So what we did is we went to a number of the clinics and community centers around the with the tribes, and held a number of gatherings where we asked people just to talk about what they knew about historical trauma, how it affected the health of their communities, what doctors should know. We also talked about boarding schools and commodity foods. We tried to get to the missionary system, but actually people spoke so much and shared so much that we ran out of time. And then when we did the analysis, we actually trained our steering committee, which is 12 people. We invited the whole steering committee, 7 people wanted to participate. So we trained them, had them take IRB training, and then we had a series of listening sessions where we listened to the conversations that we had recorded together and then coded them. And so one of the things they kept on reminding us, don't put us in boxes. And so one of the first things we had to do when we analyzed the data was put things in boxes. This is just an example of our conversation in 𝘰𝘿𝘥. And so we listened together and then we asked them, so what did you hear, right? Just basically not interpreting the data, but what are the kinds of things that you heard? And then after we went through all the 7 conversations, we gathered them together and brought out some kind of shared themes around historical trauma. And what you'll notice right off, there's a lot of concern around knowledge not being shared, addiction, abuse, not wanting other people in their homes, but also connections to the land, not knowing the geography and the history that is integral to being healthy for Native Americans. So just a couple of the things that were shared. I mentioned loss, grief, and shame. This, a lot of the knowledge systems, the food systems, how to gather food, access to healing places, all of those, because of the structural things that I mentioned, the boarding schools, the treaties, reservations, those were all taken away from them. And one way that it was interesting, we kept on having these conversations about hiding from cars. It came up in a few of our talking circle groups, and then again in the analysis, and people were actually so relieved. They're like, I thought I was the only one that did that. So what happens is that people would hear a car coming up the street, and then they would all hide, like they would close the windows, they would hide, not answer the door. And they could never figure out why they did it. They just knew that they had to hide. And when you look at the history, what happened is that social workers, BIA, people, policymakers, people representing institutions would come to the homes and take the kids, right? So you do run and hide the kids. Don't let people know that you're home. And so this is an example of that kind of trauma carrying on through the generations. People were also concerned about not having traditional knowledge, not knowing how to gather different kinds of foods, knowing how to cook different foods. And there were a couple reasons. We spent a bit of time talking about this. Parents sometimes were afraid for their children because of the kinds of punishments that they would receive by sharing the language and food systems knowledge. And so they just wanted something different for their children, so they wouldn't share that with them. But the other piece of that was that sometimes the parents didn't have the knowledge because they were taken away and put in boarding schools, or their parents died, or all the reasons we already talked about. Another thing that there was a lot of frustration around was having to jump through hoops when they went to seek medical care. One of it was the paperwork, and they saw this as another intrusion from the government of having to continually fill out all sorts of paperwork. And people, we get frustrated. Everyone gets frustrated with the paperwork that we have to fill out. But there was something really different going on that I'll get to in a moment around the paperwork and doctors never staying. If you're a physician and you go and work for Indian Health, then much of your loans are paid off. So there's an incentive for doctors to come and work in Indian Health, and once their loans are paid off, they leave. So there's this rotating circle of doctors coming in and out, and so you never get the kind of continuity of care that's required in these situations when you're dealing with a population that has experienced these histories. So there was frustration around that. And then there was also frustration around that feeling the doctors don't have time to get to know you, and they don't really care because they're just in and out. And that frustration was partly expressed by one person when she said that they treat me like I'm coming here and this healthcare is a free handout. The problem is that healthcare for Native Americans is part of the treaty system. When they took the lands and said, okay, if you stay here, we'll provide healthcare. And so to think that you're being treated like it's a free handout when this is actually something that the government promised really is a disconnect for what's happening. So there's, if we look at the history, all of the things that people were telling us and sharing with us, they're all linked to policy. They're all linked to our history, the policy of termination. You even think about our area, Riverside, San Bernardino Indian Health is primarily primary care. But before the Termination Act, we actually had a hospital in 𝘂𝘁. But California was so good at terminating some of the federal assistance that the 𝘂𝘁 hospital went away. So you see other states that actually have native hospitals. We don't. Nowhere in California is there a native hospital. And that's an effect of the policy. The reservations, again, confining people to the land. I often hear people were concerned because they talk about, this saying that you hear, oh, that person went off the reservation. But that saying comes from the right that was given to people to enslave or kill Native Americans if they were found off the reservation. So there's again, this long history keeps on coming up in terms of health and well-being and just livelihood that's connected to policy. So just some takeaways, the history of trauma, but people are living, and that is the other thing they wanted to make sure that we shared. It's not, they're still here. They're reclaiming their language. You think about Riverside, San Bernardino Indian Health, again, it's funded by the tribes. So, they're reclaiming a lot of what was taken away. Also, I've been at this with the group. We've been collaborating together for 4 years, and before that we had 3 years of conversation. So building trust with vulnerable populations takes time. Again, not all experiences are the same, but thinking about the other thing that they were always reiterating, that their health is deeply linked to this geography, to the land and the environment. And that in that way, the policies that disrupted those relationships make poor health and historical trauma a social determinant of health, not an individual problem. And so these interactions, while we were focusing really on what it meant to interact with physicians, it can apply to any interaction around health equity. because those histories carry on. So the way that we decided to disseminate everything that we learned was through a podcast. So these are the episodes that we have created. We just released our 6th episode on Tuesday. We release a new episode every Tuesday. And it's been exciting to do the project with everyone because we feel like it has a lot of meaning. The reason we decided podcasts was because the physicians are driving from clinic to clinic, and it's a perfect time for them to have a history lesson and think about what's going on with their patients. So 𝘰𝘊𝘥, thank you. And I also want to thank our leadership team, steering committee, and then Catherine Rodriguez and Wyatt Kelly, who have been our program directors. So thank you.
Thank you. That was wonderful. I certainly have some questions, and maybe others do too. We're a little bit behind, so I'm going to ask everyone to hold questions so that we have time for the panel. But I think there are some questions maybe that come up that we can put in the discussion session. That's certainly a lot of food for thought. Okay, and we're going to move on for now to our next speaker. Our next speaker is going to be Dr. David Biggs. Dr. Biggs is an environmental historian and associate professor of history and public policy. His work focuses on relationships between humans and natural systems. And so with that, I'm going to give the mic to Dr. David Biggs.
Okay, thanks, Will, and thanks to the leadership team. Can everybody hear me? All right. So we have 20 minutes. Just very briefly, I'm going to be speaking today from a very different place. I'll be talking about sites in Vietnam where I've been working for about the last 10 years. But I want to use the stories that I'm going to tell as a way to think about process and to think about how different, from different disciplines, how we engage these problems about health outcomes, about policy. A brief note, I'm now fully in the Department of History, and I made it to professor, so some nice extra things happened recently. The stories I'm going to be telling actually come from a book. Oh, Siri, hold on. I got to change my preference. No fancy background. Let's see, take it off. There. The stories I'm going to be telling are coming from this book, Footprints of War. I just say that partly because 80% of what academic historians do is we write books, we tell stories, we reflect. Most of our work is not prescriptive. Maybe 20% of what historians do is working on court cases, working with teams to find historic data and bring it in. But most of what we do is reflective. And so I think a big question I'd like to present for this group is how do researchers whose work is telling stories, whose work is primarily reflective and looking back, how do they integrate in some of these projects? And maybe we can go forward there on the Salton Sea. I have to confess that I'm also completely exhausted with Zoom screens. I'm so fatigued. I was in a defense that went the full 3 hours yesterday. And so I'd like to offer a little bit of a break. I'm going to turn off my video. I just picked a nice picture of a valley oak taken by Ansel Adams, and I'd like to invite you all to turn off your video as well, and just to listen. I'm going to try and tell you a story about my work with Agent Orange. So I'm going to turn it off. We're already down a minute or two, so we've got 18 minutes. And I'd also like to dedicate 1 minute of silence. I'd like to ask that we just simply meditate for a second on the incredible loss of life that has been taken, the toll that's been taken. As of today, over 360,000 people are dead from this pandemic. So I'm going to start my timer now, and I'll chime back in about 60 seconds. I'd like just 1 minute to to think about that. All right, so I'm going to tell a story, and the story is about how I came to this topic and some of the challenges. And the topic in particular that I'm interested in are the environmental legacies of war in Vietnam. And I think when most Americans hear that, you know, if they've watched the news or a few documentaries, one of the first images that comes to mind is the use of an herbicide, Agent Orange, to spray forests in Vietnam. This was a program that went from 1962 to 1971. About a third of South Vietnam's forest cover was destroyed with this program, as well as crops. And what happened in about 1969 was that scientists began to notice that a contaminant, dioxin, TCDD dioxin, was having morphological birth defects in mice, lab mice. And there were reports of other similar health problems in Vietnam. This became amplified by the anti-war movement in the United States. When veterans came home, some of the largest class action lawsuits in American history were brought against the Air Force, against the United States government. And Vietnamese plaintiffs in 2004 or 2005 similarly brought a class action lawsuit saying we estimate 4 to 5 million people in Vietnam have been exposed to dioxin. What's the United States going to do about that? And the answer was they didn't have legal standing in American courts. So I was fascinated by the topic, and I went to central Vietnam, to Hue, the former imperial capital, and began doing research. And the archival research is pretty straightforward. Looking through American records, it's highly detailed, every spray mission. But the work that really fascinated me was going to some of the defoliation sites and some of the former US military bases and talking to people in these places. And one of the things that quickly came out was that they weren't that concerned about Agent Orange. And I followed that up, you know, well, what are you concerned with? And a number of people said, well, there's CS, which is tear gas. There are paints. There are other contaminants which are in our groundwater, which were left over by the base. And what quickly became apparent to me was that the toxic profile, the toxic history of the US war in Vietnam was much more complex than just one chemical. In fact, there were at least 30 or 40 chemicals that are now listed, many of them industrial chemicals. So I began writing a story about kind of the comprehensive chemical war in Vietnam. And as you might imagine, that was very sensitive in Vietnam. And I had very good advisors there, scientists, as well as a few local officials. And I was quick to ask them, well, why is it so sensitive? And they said, well, primarily because of land. The land is so valuable. And not just that the land is valuable, but people are buried in that land. And this really struck me when US forces had to set up bases in Vietnam, this is a place that's been settled for well over 2,000 years. The only places available was dead land, or land where people buried their dead because they couldn't farm it. And so this further complicates the story, because it's not just about chemicals that have created this dead land, but it's also land that to local people where their ancestors are buried. And I developed these stories, I cover these stories in the book, but where I want to turn to is kind of what happens next as the historian building these stories. Well, I was a Fulbright scholar in 2011. At the end of my time, I was invited to the US Embassy in Hanoi to talk about my research. And I was really curious about the response. And I basically shared this broader picture of chemical contamination. And when I gave my talk, there were two parts to it. The first part was public. Some Vietnamese people showed up. The second part, they kind of brought me back to the behind the glass and the secure part of the embassy. And there I met a US Defense Attaché, a USAID representative, and they were really curious about the story. And the gist of, I told them was what I told you, but in more detail. And then the USAID person, was an older guy from the Bronx. He had a really strong Bronx accent. You know, he said, well, okay, what do you want to do about it? What do you think we should do about it? And I said, I don't know. I'm the historian. I tell the stories. I publish the stories. But it looks to me, you know, like most of these bases are the equivalent of a Superfund site in the United States. They have similar chemicals, and I imagine a comprehensive cleanup would be very similar. And I could see him running the numbers through his head, trying to imagine roughly 4 dozen large base sites in South Vietnam, what that would cost to clean up. And he just looked at me and he said, yeah, that's never gonna happen. I could almost picture him with his Yankees cap. He wasn't wearing a Yankees cap, but you can, so I left the meeting. And what happened next? Well, nothing really on the American side, at least not very quickly. I did publish some articles. I published an opinion piece on a Vietnam series that ran in the New York Times. And that piece got some play. And I was called after that piece came out by the assistant ambassador in Cambodia. And as well as some people who reached out, former US Air Force and Army helicopter and fixed-wing pilots, people who worked in the defoliation program. And the pilot said, yeah, you're talking about tear gas drops. And to explain this tear gas, we know about Agent Orange. What was done during the war, Americans were trying to pull communist forces out of underground bunkers and tunnels. And they were far enough underground that most forms of conventional bombing didn't work. And so they devised a kind of highly concentrated powdered tear gas that sticks to walls and sticks to skin. It's highly caustic. And they called this CS2. And they actually dropped it out of 55-gallon drums with a phosphorus fuse that detonated just before impact, so that it would spread this powder into the tunnels. If you're in the tunnels, you become asphyxiated and die, most likely from suffocation. And so tear gas is not considered in the environmental toxics community as being as toxic as something like dioxin, but in this context it was. And we dropped a lot of it. We dropped so much more tear gas than we did dioxin, and we dropped a lot of it in Cambodia. We did it in 1970, and this has only recently become declassified. And so this person saw my article talking about tear gas, the pilot, and he explained exactly. He said, "You got it." He said, "We took off from Vietnam. We flew across the border. By the way, if you can hear it, there's a helicopter going overhead right now. I didn't plan that. We dropped it in Cambodia. We dropped a lot of it, and then we returned to our base in Vietnam. And the reason that the assistant ambassador in Cambodia contacted me was that Cambodian villages have been doing really rapid development in eastern Cambodia for forestry, industrial plants, other things. And they've been digging and finding undetonated 55-gallon drums of this powdered CS2. And at first, they thought it was mustard gas, and they ran stories in the Phnom Penh newspaper saying the United States forces used mustard gas, which is totally illegal. It violates the Chemical Weapons Treaty. And we, as far as I know, we never used mustard gas in the Vietnam War. But so the assistant ambassador was interested in the story I was telling about this broader framework of chemical war. And what came of that, I don't know. That's not what historians do. I don't work with these people, and I don't really make prescriptions about what should be done. What I think the most important value of stories like that is really to challenge us to move beyond conventional narratives, conventional storylines. We all know the Agent Orange story, but we don't really know these broader stories. And I think that's really one of the great values for reflective research. So many stories about the Salton Sea that have not been told, especially stories that haven't been told from the perspective of the peoples, the native peoples, migrant peoples, other peoples who've lived in that area for one or more generations. So I think there is a lot of work to do. One other little aside. So while I was working on this research in Vietnam, I stay in a little divey hotel. It's a 3-star hotel in the 5-star system, which means $20 a night. But they have a fantastic little swimming pool. And I travel there with my family, all 5 of us. And one day the kids were talking to an older man in the pool, an Italian man. And of course, my first response was a parrot was, why is this old guy talking to my kids? But then I got to talking to him, and he is a geneticist. He works in Bologna. Giovanni Romeo is his name. He worked with Craig Vintner briefly at Stanford, the guy who invented 23andMe. And he was doing a teaching stint in Hue. And they're doing new research on what's called DNA methylation, how our human genome responds to environmental changes, in this case, exposure to dioxin. And they were trying to characterize how people, those exposures of people where they were taking samples, blood samples in this case, and then they were running these genetic assays on their samples. And so we actually collaborated. I was able to help them to characterize some of this. And in the turn of that collaboration, they really opened up new ways for me to understand the kind of historic trajectory of dioxin contamination and how it works. And I think one of the big lessons I took from that was understanding that when we talk about toxic exposures, and this is important for storytellers, for historians, we're not only thinking about one discrete human being in one discrete moment having some health impact, but in fact, through DNA methylation, they pass on modified genes to some percentage of the offspring. And in some cases, they tested former war veterans, their children, and their grandchildren, and they found genes that showed some change that are related to growth and to early growth. And they found those genetic markers in the grandchildren. Did they find dioxin molecules in the grandchildren? No, the grandchildren had no dioxin molecules. So this really challenged me as a storyteller and as an historian to think about the sort of the temporal trajectory of an historic event and the legacy or footprint of those events. So Yeah, so I'd like to end again by just challenging the group, as we are a mix of economists, social scientists, anthropologists, historians, scientists, about how we work together, and really the sort of benefits, but also the challenges of collaboration. And the thing I'd say for historians, especially environmental historians, is that they're nobody's favorite person. They tend to tell, the problem when you tell complex stories is that you pretty much piss off everybody. These aren't the stories people want to hear. These aren't the stories that my Vietnamese audiences want to hear. And they're certainly not the stories that many American audiences want to hear. But I think they are really important stories. They're stories that need to be told. So I'll end there.
Thank you very much. And thank you for the invitation to...
Can I add one last little thing?
Of course.
Okay, so as most of you know, Vietnam is the Socialist Republic of Vietnam. It's run by the Communist Party. American scholars are often, held in fairly high suspicion, and doing this project was a challenge for those reasons. But there have been really amazing changes, talking about audiences, in the last few years. And that there's been a real interest in what foreign scholars are writing and translating them into Vietnamese. So this is my first book. It was translated last year, and the work of translating is highly political in Vietnam. 𝘒𝘂-𝘠𝘠, she's an amazing translator, and there's the very subtle politics to her publishing house and bringing. And she's just bought the option to translate the second book. So I'm excited about that. Okay.
Thank you. That's very cool. I think, and language itself is, of course, so important in terms of how we frame what we do with people, in terms of outreach, in terms of accessibility, in terms of justice. So I think that's a really good point. And thank you also for the invitation to turn off and just listen for a little bit.
Good.
I think that's perfect, right around the 11 o'clock 1 hour mark, for us to just kind of relax a little bit.
Yeah.
All right, thank you. We're going to move on to our next speaker. And again, we'll circle back, I think, to some of these same topics for the discussion panel, which I'm really looking forward to. And our final speaker and member of our panel that I'm going to introduce right now, before we get into that session, is going to be Dr. Philip Lehman. And Dr. Lehman is an assistant professor in the Department of History at UCR. His work focuses on histories of colonial data gathering, development of climate science, emergence of a global environmental vision in the geographical and earth sciences. So Dr. Lehman, you have the floor.
Thank you very much. And well, thank you for organizing this meeting and also the talks that we've already heard. I have been having some internet issues. So I don't know if you've noticed, I've been kind of off and on. So I think I'm also going to switch off my video and only do the screen share to kind of keep the bandwidth low. I think my wife and I are currently competing over bandwidth here. Okay. So yes, my work has been mostly on climate science, the history of climate science, the history of climate change theories, especially in the late 19th century, climate engineering projects in the early 20th century. And some of you who have been at the meeting, I think it was 2 years ago, may have heard a little bit about that project. And more recently, I've been working a lot on the history of climatological data gathering in colonial environments, especially in Africa. And so all of these topics are in some ways, if not directly related to the BREATHE cluster. But I should also say that currently, when I'm not parenting at home, I've been trying to work on the revisions of a book manuscript. And that makes it both difficult, but also really exciting to talk about some other things. So today I will look at some ideas I'm thinking about for what could at some point become the next project. And some of these ideas have been directly influenced by the current pandemic that we're living through, and you'll see the connections very clearly, I'm sure. And just to kind of reiterate this warning again, this is a project that doesn't actually really exist yet. These are basically some ideas that I've been kind of playing with, and I've been thinking about recently. And I hope they will be in some ways kind of useful for discussions within the BREATHE cluster. So I have a very bare bones PowerPoint presentation I'm going to put up now. Let's see. Okay, is that showing up? Okay, perfect. With the title Healthy Airs, Unhealthy Waters. And this title is actually taken from a medical pamphlet that was printed in Hamburg in the mid-1890s, so a long time ago. And Hamburg is a really interesting place in the context of medical ideas and experience. Let's see here, in 1892, Hamburg underwent a very bad cholera epidemic. There were a lot of German cities kind of underwent a similar pandemic, or epidemic, I should say, during this time. But in Hamburg, it was a lot worse than in any other place in Germany, and probably in any other place in Europe during that time. About 10,000 people died within 6 weeks during this epidemic of about 350,000 inhabitants. And there were a variety of factors for the intensity of the pandemic, and maybe chiefly among them the unpreparedness of Hamburg's leadership. Hospitals were too few, and they were understaffed and under-equipped, and this may all sound all too familiar today. And the crowding of the working class quarters made the transmission of the disease easy and very hard to trace. City leaders also refused to sound the alarm bells until about 6 days into the epidemic, and maybe most negligently, the city leaders of Hamburg had not started treating the water supply of the city against bacteria, something other European cities had started to do after Robert Koch had identified a bacterium that was responsible for cholera. And all of this together led to the very high lethality of the epidemic in Hamburg. This experience made the German city also into a hotspot for all kinds of medical theories during the time. But to take a look at the other side of the title of this short talk and the title of the medical pamphlet that I was referring to, it was the healthy airs compared to the unhealthy waters. Because at the same time, this is in the kind of 1890s, starting really in the 1870s, but developing into much more of an industry around the turn of the 20th century, was the development of the air cure movement. And it has taken off first in Germany, and it would soon spread to other countries, among them Switzerland and also the United States. And proponents of the movement advertised taking the airs against tuberculosis especially, and also other diseases, not only in mountains, but also by the sea. And incidentally, there were a number of places just around Hamburg that transformed themselves into air cure resorts and air cure towns. Like, for example, the island of Sylt. You can see a postcard, an advertisement rather here, that is advertising Sylt as one of these places where the air was particularly healthy, and was advertising itself as this basically something in between a resort and a hospital. But this development was not only restricted to Europe or America, although it was a development that was clearly driven by Western ideas of science and medicine, but the colonies also became very important. And this was true especially when it was difficult to find a particular economic benefit that would justify colonial expenditures for a particular colony. And I've been working mostly on German colonies in Africa, and so this is also an example from that. This is German Southwest Africa, today Namibia. And proponents of the air cure and also pro-colonial activists try to sell the very dry desert air of the colony. It's a very arid colony, as a valuable medical asset. There were all of these plans. There were basically, most of them cut short by the onset of the First World War, but a lot of plans to transform the colony into somewhat of a resort / hospital colony for German patients. And there was also kind of another idea behind this, and this was to kind of use these air cure resorts as a way to lure patients into the colony, and then with some gentle pressure make them stay and become settlers in the colony. Because one big problem of German colonization in Namibia or Southwest Africa was that there weren't enough Germans interested in actually moving to the colony. Other colonies, on the other hand, for example, German East Africa or Tanzania today had a very different reputation at home, much closer to the depiction of Africa as the white man's grave, with diseases from malaria to sleeping sickness killing off European colonists. And rather than trying to entice Germans to settle in the colony, so in East Africa, the colonial office actually printed regular warnings in their magazines and advertisements to keep Germans from traveling to the colony at all. So kind of very different models in different environments. But what I'm interested in each of these examples is how particular landscapes become healthy or unhealthy in the popular imagination. And as a historian, my period of expertise is in the late 19th and early 20th century, as you're probably aware from these examples as well. So I will focus here on those examples. So why did particular places and landscapes become healthy or unhealthy is kind of the leading question here. And unsurprisingly, this did have much to do with medical knowledge and also the popularization of medical knowledge. As we can see with the example of Hamburg and the North Sea, the idea that drinking water could be unhealthy was now directly tied to the germ theory, or more exactly with this particular example, to the discovery of waterborne pathogens responsible for cholera. But this did not mean that older forms of knowledge simply vanished. If one looks through the newspapers, but also the council reports of Hamburg from the time, older ideas of unhealthy vapors and miasma were also still quite prevalent, and not only among the general population of Hamburg, but even among medical professionals. This germ theory kind of had been developed, but it was still not fully accepted everywhere. And it was also a mixture of these old and new ideas of how diseases were transmitted and thus could be treated and healed that provided ground for the air cure movement that took off in the mountains and the German seashore from the 1880s, that can really combined a lot of different aspects from both medical theories and formed it into a kind of hybrid medical field. Beyond the medical theories, however, it's also important to look at economic factors here. And the examples that I've been talking about, it's especially the kind of rise of the medical and the health industries in the 19th century. Once again, the example of the air cure movement, which started out kind of very small, but soon became kind of a very big economic field and economic industry, really, especially on kind of on islands on the sea coast of the North Sea in Germany, and then also in the Alps, in Switzerland, in Austria, in Germany, and soon kind of spread to all kinds of other environments. Also the Rocky Mountains in the United States were a big place for this. And while there were a number of the proponents of the air cure, like for example, the American Edward Trudeau, who built up air cure stations as public goods with very cheap accommodation, the air cure industry also developed very rapidly into a hybrid kind of tourist and medical attraction that tried to bring in especially wealthy tourists or patients that would bring in money. And this also meant that it was now economically useful to designate certain areas as healthy and others as unhealthy. And of course, this was then also connected to the rapid growth of industrial cities in Europe in the second half of the 19th century, with all of its attendant problems of overcrowding and air pollution. Air pollution became actually kind of one of the founding concerns for some, what we would call today, environmental groups in the late 19th century. It kind of rallied around the issue of air pollution, especially in the heavily industrialized areas of Europe. And thirdly, there were also political factors in play here. For Hamburg, it's an extremely complicated story of a desire to remain politically as independent as possible from the newly formed German nation state. Hamburg never was too happy to be incorporated into that nation state, and tried to stay as independent as possible in the late 19th century. And thus they were also not taking part in some of the regulations that were passed down from Berlin and kind of tried to do their own thing, among them not actually treating their water supply. And another factor of the experience in Hamburg was the importance of class and the particular geographies of class here. So the cholera pandemic hit the overcrowded working class district the hardest, which also had, of course, the lowest coverage of hospitals. And it ultimately inspired a long-lasting resentment of working class Hamburg residents against the political leadership. And maybe this kind of, goes hand in hand with Juliet's comments about kind of the trauma that persists after, an event that may be long in the past. So here, the trauma of this epidemic, especially among the working class, which could still be felt in the 1920s in Berlin, which became known to be kind of Red Berlin, communist, communist Hamburg, Red Hamburg. And in some ways, you could say it was even still felt today. If you go to Hamburg, the kind of left-wing working class culture is probably still a lot more developed there. And even today, there's kind of, if you go around, quite a lot of kind of not monuments in this term of kind of built monuments, but rather kind of reminders of the cholera epidemic in the late 19th century. So this has had a very long and lasting history. And in the case of the attempts to establish air cure stations in the colonies, the political stakes were very clear. If declared healthy, the colonies could be made into an economic and thus also a political asset. But these discussions about air cures in the colonies were also very tightly connected to race and issues of race. So unhealthy environments would be left to Africans, like East Africa, while the healthy environments, like the German Southwest Africa or Namibia, would be settled with Europeans, while the Africans had to make room, and this was usually done by violence. And this is then also very directly a connection to issues of kind of justice, of all kinds of racial, of economic justice and environmental justice. So before going on to the next and final slide and just talking more about how some of these themes can hopefully be useful for the Breathe cluster in one way or another, I just want to emphasize two things. And first, that it's by no means an exhaustive list, this one. It's one that I have just kind of come up with to make sense of some of the things that I've recently been reading and been trying to learn about. And second, this list is really for thinking purposes only, to break them down into these particular factors. I think these factors never worked on their own, but we're all intricately interconnected with each other and difficult to separate. This speaks to what David has just said about the stories that we historians tell that always are very complex and very difficult to break down into these kind of disparate categories. Okay, but overall, I think it is important to look at the imagination of particular landscapes as healthy or unhealthy as a very complex process that is influenced by many different factors, including those of class and race. Finally, some thoughts about how some of this may fit in with Breathe and some contemporary public health issues in general. While many things are different today, many of the same factors still work to create healthy and unhealthy landscapes. Oh, am I still there?
Philip, are you still there? We could hear you. You got a little choppy, but
okay.
I can still. Yep.
Okay, now I'm back. Yeah, I think so.
Okay.
I got the warning that I got. I was reconnecting.
Oh, gotcha. Yeah, I got a little choppy, but we can still hear you.
Let's see, is the screen still okay too? It's not
yep,
that
the screen is fine
actually for this. Okay. So yeah, at the end, I just want to make some comments about how some of this may be useful, or kind of useful ideas to think about in the context of the Breathe cluster. As I said, kind of many things are different today, but some of the same factors still play a role in different ways, obviously. economics, politics, class, race, they're all still very important when we think about how landscapes are perceived today. And that includes the Coachella Valley, and maybe especially the Coachella Valley, which has a very interesting kind of both racial, ethnic, and also economic makeup. And by the way, I also want to make sure that don't sound like arguing against the actual health risks that exist. Air pollution, the aerosolized toxins are clearly there. Just like cholera was actually an issue in Hamburg, but it is often factors beyond the field of medical research that determine how a problem is conceived and what is done about it. And so the Salton Sea, or also the Coachella Valley in general, is a fascinating example for this, because the air quality issues, as you probably most of you know much better than I do, come from a variety of sources: industry, logistics, agricultural runoff, global warming, and so on and on. And they hit particularly vulnerable communities the hardest, especially those of agricultural workers. And these, as we've already talked about, often get left out of discussions, of the public discussions about how to solve the problems. But the air pollution also hits Palm Springs, and thus its wealthy residents, and most of all the vast tourism and retirement industry. There were recently a couple of articles in local newspapers about kind of projections that the air quality in Palm Springs will deteriorate over the next few years very drastically. And this produces both an at least potentially well-funded need to improve the situation, but also an incentive to portray Palm Springs and its surroundings still as a healthy paradise free of any issues. If you just go to some of the web pages of the hotels and spas that are there, it's quite amazing to kind of see, read the copy and look at the images of pristine environments with healthy, crisp, clean air. And so ultimately, the publicly perceived severity of the issue of air quality is determined by a number of factors. And I think the Coachella Valley is particularly interesting, as I said, with that regard, because of its particularly diverse racial and economic makeup, and also of the very different economic interests that are at play here. So that's really it for me. And these are just kind of some of the issues that I've been thinking about. As I said, a project that is not really a project yet, but rather some ideas. But I would be happy to hear what you have to say about them. Thank you.
Thank you very much. I think these have been 4 really interesting and provocative talks. I'm really excited for this next portion. We're going to move into a moderated discussion. And it's my pleasure now to introduce our moderator for this session, Professor Bronwyn Liebach, who is an associate professor of political science. And her interests are largely in human rights and environmental justice, both in terms of education and activism. And so I'm really grateful to have her participation. And I'm going to give her the floor. We have a small pool of questions that are going to be available to discuss. If you have a question that has come up for you that you'd like to float to the panel and have them respond to, you can also use the raise hand. And as we can, we'll get to questions from the audience as well. So Professor Liebach, you are now in control.
Thank you so much. Can everybody hear me? Can you hear me okay? We had technical difficulties, so I ended up joining on my phone, which I haven't really done before. So it's kind of, the controls are a bit new for me. I want to thank all the panelists for your remarkable presentations. It's rare to have just such a strong panel with just every paper delivering powerful and distinctive insights on a really urgent problem of our time, one that links so many disciplines. I just have a quick, I don't know if I can take the moderation privilege to kind of pose a question of my own, and then maybe begin with the questions that have been gathered by the organizers, which are also really provocative and interesting. I just wanted to we've commented from different perspectives of history, anthropology, and health, and I just wanted to bring in a kind of reference to the symbolic here, that I think that it's interesting to think for me about the Salton Sea area as an area that I think interestingly kind of appears very peaceful and beautiful, but then has all this harm. in the landscapes, embedded in the landscapes, it is also an interesting symbol to me of how we think about memory as a story in our minds that we can stop telling ourselves if we want to, and that we often talk about memory in this manner, like as Juliet was suggesting, just the way that we think about individuals changing their behaviors can get healthy. And we think about memory this way too, right? That like we can just stop remembering things and leave it behind. And I think sometimes when the Salton Sea sometimes seems to me to be a symbol of what's problematic about that thinking, that it looks as though we can just, the sea looks calm, but it's not hard to, you don't have to get very close to realize that the harms are still there, and that memory is not just in our minds, it's creating, it lurks in landscapes and in our bodies, creating harms that persist. And so the main questions that I have coming for myself would be just to think about these themes, and from an environmental justice perspective, to kind of push the panelists to kind of develop the linkages across the papers around, naming, do you name this as violence? And then thinking about, we talk about harm and ill health, but when do we call this also a form of violence, and how do we see this manifesting as violence? And in doing that, I also am interested in as I'm watching my neighborhood where I grew up in Minneapolis is on fire and has been on fire and burned. And I'm watching my friends out there thinking about the issues of racism that across all the panels, and thinking about those two intersecting themes as environmental justice themes. I'd just be interested in hearing a little bit about that, and how that, I think all the papers have a lot to say about both of those themes. And the first question I have, I guess maybe it would be, I think the goal, and I can just like ask if this is okay from Will, in terms of thinking about, I've been given 4 really pretty big sized questions here. So I'm wondering, should I just start with, I think with the best way to proceed to be to just start with the first big set of questions and then have the panelists respond, or throw it open to the audience?
I give you full control over however you see that. You can use any or all of those questions, or if questions come up from the audience, you can jump to those, or you can intersperse questions that come up for you as well.
I think, I think I'm just, they're awesome questions. They're big questions. Okay, I'm going to start with the first, and then and then we can also, and I haven't seen any raised hands yet, but that could be from my phone.
No, I don't see any raised hands yet either. So if people do use that raised hand function, we'll try and get to you. Otherwise, if there's no raised hands, I think you can just go ahead as you see fit to choose or adapt.
Okay, so I'm going to just pose that first question here too, from the organizers, which is a question of where are the frontiers, unexplored areas in health or environmental justice research that you take to be the most interesting, transformative, and important in your fields or areas of research right now? And I guess I'm going to link this to the second question. What is, how do you think of, in part, what do you think of as driving the research in these fields? I think those questions are nicely linked, but there's more to that second question that I will expand on after. So why don't we turn that back to the panelists? The frontiers and unexplored areas of health and environmental justice.
Okay, can I volunteer a 30-second response?
Yeah.
And I want to challenge my panelists because I know we're short on time. I've been watching on the sidelines one of my grad students do research, Todd Luce. He's finishing. One of the things that amazed me about the Salton Sea in particular is the question of time and being in that time period. We tend to think of it as a 20th century narrative, but it's a sink. It's not a lake. It's not a sea. It's below sea level, and it fills up every 400 years, roughly. And you can see the old Pleistocene as well as old early indigenous people boundary of the lake on the side of the hill. And I think that presents a really big challenge as far as thinking of this in longer time scales. And that's where indigenous ideas of the space, I think, are really important.
Thank you. Thank you. Other comments?
Yeah, this is Kurt. So I think kind of the frontiers are kind of multidimensional in a sense, and it relates to me what I call measurement error. And you know, since my goal to some extent as an academic economist is to inform policy, I think about how the research that I do and we do better informs policy. And when it comes to measurement error, that messes up our conclusions in terms of what we can say. So I see, you know, in terms of reducing measurement error, geographic precision with GIS and the ability to get much more detailed and granular data as being a frontier now that's available to come up with more informed or accurate estimates of these relationships. I see that also leading into better relationships or in terms of bringing in the environment, in terms how we represent the environment and its impact on our well-being. I also see the interdisciplinary elements in terms of working with anthropologists and sociologists in terms of looking at the impacts on families and disadvantaged communities and such. Whereas, you know, before economics was about GDP and such, right? And so the more we understand and we get granular with the impact with reducing measurement error on both the environment, on human health, the more informed research we can do to better inform policy, I guess. And, you know, economics also has moved to some extent. We're thinking about equity more. And I think that's partly because we're listening to anthropologists and sociologists more about the impacts of policies on society, rather than just using GDP as a metric and stuff. So I think, you know, in terms of frontiers, it's reducing measurement error through GIS, through better data, through interdisciplinary research.
Thank you. Well, I just wanted to add on to what you said, Kurt. I mean, or say this isn't quite what you had in mind, but when you're talking, it makes me also think about the legal issues that come up here and just how sort of measurement gets used in kind of legal claims, and thinking about the causal relationships that have to be established in order to, you know, sort of address certain things, not just in policy arenas, but to meet certain legal standards or to revise those legal standards. And the measurement questions are always coming up. And so that might be another thing to think about, is the borders of law and health and policy as well. Thank you so much. Yeah, other comments?
I just want I love both what David and Kurt shared and the whole panel. This has been amazing. Because there's so many opportunities for collaboration. And so this what I'm going to say may not be surprising, but I encourage, you know, that we continue to do more community collaboration. So an interdisciplinary team should include community members. And for me, that's how we get at a lot of the questions around measurement errors, around, you know, what the stories are, what it means to people, even that symbolic question of violence. You know, how do things work at the ground level for people? How do we continually remake capitalism, or how can we continually remake something else, a better way of living in the world? And, you know, thinking across the time, as David said, and thinking about the measurement error. So when we talk about interdisciplinary teams, we need to think a bit more broadly, because that will get us at those intersections that can really make a difference for how we interact with each other and the way we do our science.
Thank you. Yeah, I absolutely agree with that.
Just as a quick add-on, I think, you know, I think what's also really important, and this is something that I think in climate science we've seen a lot more recently, is kind of the use of not only quantitative but also qualitative data, and the incorporation and the integration of the two, which is so difficult because in some ways they're often non-comparable. But I think that is something that is probably going to remain a big problem of this interdisciplinary work, but that's something that I think we always have to strive to somehow work towards.
Yeah.
Can I add one last thing too? I said 80% of what academic historians do is write books, but public historians, almost 100% of their work deals with communicating and telling these stories to large audiences. And I think, you know, we're one of the strongest campuses in California for public history. And they've done tremendous work, more on the coast in LA. But I think there are some real opportunities for our graduate students and for faculty. Kathy Gudis, as well, is very much involved in some of these initiatives.
Thank you.
Sorry. And yeah, thanks.
I just want to stick in a dimension, because you guys are kind of moving into the sort of terrain of the next set of questions. So I just wanted to stick in a theme that comes up in one of the questions that I think is interesting to kind of put into the mix here, which is that the question is posed. It's like recognizing that a lot of the research, kind of getting to the heart of our sort of interdisciplinary kind of complementarities and tensions, but that humanities research tends to be reflective and interpretive, while social science research is as they put it here, more prescriptive, but it's also evaluating causality in a different way. And so so the question is framed here, you know, what kinds of challenges, opportunities, and strengths do these differing approaches to research bring to us? That's one kind of way of thinking about these, you know, interdisciplinary collaborations. And then another question that's linked here that we can just continue talking about the things we were talking about, but also just throwing this in the mix. Asking the question here is asking for, you know, can you think of specific success stories of from your interdisciplinary collaborations and benefits of this collaborative work from different fields? And how do you I mean, I think many of you have already discussed this, but how do you identify or specify what has been the most significant success that you've seen or been a part of as a result, or in terms of interdisciplinary research synergy? I think that's an interesting question. So you could answer these, but you could also just address other things that have come up.
I'll start. Environmental economics was really got its start between the relationship between a physicist who realized, hey, this pollution is residuals and it's not a one-off issue, it's pervasive. And so a physicist and an economist working together really was the basis for environmental economics in the late 1960s. And you know, for probably my own successes and I'll never achieve this again, but I was fortunate on my dissertation committee. I had a soil scientist and a biological engineer, and we were able to reevaluate North Carolina's water quality laws and regulations, and actually in their water quality regulations as part of my dissertation. And it's just because I had a really good soil scientist, I had a really good biological engineer, and my advisor was a really good economist, and I just kind of followed what they told me. So it wasn't me, it was, you know, it was the grunt. But you know, it was that unified voice, I think, is what really matters, right? If you know, politicians, and because of the politics, they just see you out there on your own, you know, you're one voice. But if you can get the science, you know, the economists working with the anthropologists, working with the sociologists, working with the earth scientists, and the law, if you get that unified voice, it's so much more powerful. And that's kind of maybe what I see as what my success was for my dissertation, was I had this unified voice going forward.
Oh, that's a great example. Thanks.
I think with kind of the humanities, it's not always easy, I think, from both directions, because often it either seems like, you know, the humanities person can give some historical context to what is kind of the real work that is being done, or on the other hand, the historian just using some kind of, you know, paper and the kind of the result of some paper, some scientific paper, the natural sciences, to kind of basically provide some background that is needed for whatever history that historian is telling. that it's not that much of a collaboration, even if it's sometimes advertised that it's rather kind of using each other for kind of contextual information. And I think it's very rare to actually see really successful projects. I think I was maybe only part and in Switzerland. You go.
Yeah, you're going in and out a bit. I think we're losing you.
Can you turn off your video?
Yeah. Okay, maybe we can wait. Come back to him when he gets back. Or if you can hear me, then maybe just let us know when you get your feed going again. Yeah. And in the meantime, maybe someone else would like to share an example of a success or another comment in response to some of the other questions.
Go ahead, Juliet.
There were so many things bouncing through my head as you were asking that question, because I think about interdisciplinary work, and research by itself is messy. So, interdisciplinary work is even messier, and trying to figure out the different epistemologies, how people work, and the expectations. But we don't get there. And this is probably a bad word for the moment, but without contaminating each other, right? So I'm thinking of Anna Singh's book, yeah, The Mushroom at the End of the World. This idea, that we need to have each other and the different perspectives, and willing to be with that uncomfortability, uncomfortableness of stretching our imagination, stretching the synergies and the possibilities. And so, it's exciting to think about sitting with that, both as our ideas come together, but also then as they come apart, and we kind of do our things and the conversations that we're having. So really having that freedom and respect for each other and what we're doing, to bring it together, and then to let different pieces, do what they need to do. So to me,
I love
it's exciting.
that. And we sometimes want things to be clean and neat in our research design, but this interdisciplinarity is sometimes kind of messier and less predictable how it's going to affect us. Yeah, I love how you put that. Thank you.
Can I add on to that too? I think a big challenge is the conventional university itself. Everybody's under so many pressures to produce within their own disciplines, to write the kind of work to justify what they do, the amount of money that it costs to carry out research. And so, thinking about the Salton Sea, thinking about putting on community public history events, museums, all of that costs money, and very little of it is really recognized by our peers as substantial academic work. So I think we also have to reckon with the university, and maybe it has to do with small changes in terms of your public profile as an intellectual. How do you engage communities? And I think we're all really good at promoting our own selves in our academic discipline and sort of defending that. But that other area, it's very much feels like volunteer work. And so I think, yeah, stop there.
Yeah, that's important. The university kind of structure definitely reproduces disciplinary boundaries in ways I don't think I fully appreciated when I first got started.
Yeah, and I mean, and think about the work that UCR has done to date on the Salton Sea. So much of it is around patents, engineering, filters, about publications, technical publications. That's kind of the way the university prioritizes what we do. So yeah, it's demonstrating some other value is still a challenge.
Mhm. Thank you. Let's see. So I have one more question here, and that is the research. I know we're running out of time, but the last question here is research wish list. If you could have any instrument, collaborator, other research asset right now, other than money and time, what would it be?
Graduate students.
One dedicated staff person to manage the umbrella of all the grant applications and all the public communications.
Okay, that's a very practical request. Okay. Any other comments?
Well, when I read that question, I thought 𝘮𝘰 𝘠𝘤𝘪. I would love to collaborate with her. And then as I heard all the papers, I'm like, we all need to do a project together. David's got lots of money. So we don't need to worry about that. But
Yeah.
Not me, the other David. The other David.
You don't have money? Come on.
Your money, David. No.
Yeah, David Lowe has money.
Well, I do play the lottery, so we'll see.
Yeah.
Oh,
Other-
yeah. I think I think to become a better writer, first of all, in terms of how to take our science and make it appeal to the public and the policymakers.
Interesting.
And because I think that a lot of times the answers are out there. We kind of understand these relationships. Obviously, we can always, the more you know, the more you don't know. But the idea to take this really good research and find the best way to make it appeal to the public and to the people that make the decisions. And I think that's, if I could have one tool, it would be that ability, because today is a perfect example of how that is lacking, and the consequences and the costs of people not listening or wanting to listen, or being enticed or incentivized to listen to science and all types of science, right? Social science, humanities, natural science, etc. So that would be my wish list. My wish.
Yeah. Important point. Yeah. And it
So-
gets also the boundaries of policy and politics as well, I think, which maybe need to be pushed a little bit at this time, at this juncture. Yeah. Well, I think I heard a voice out there.
Yeah, I actually, to kind of go on that theme, I think, these kinds of discussions are really great. I think we can reinforce them, not just by communicating to the public, but by better translating our disciplines to all the other people in this discussion, better translation across disciplines.
Yeah, absolutely. Yeah. Well, I think it looks like we're out of time. Are we supposed to wrap up at noon? Is that right? Someone might be coming for the room soon. No, I'm just kidding. It's a Zoom joke.
Very good.
Is that right though? Are we supposed to wrap up at noon? And
Well,
Yeah, this is around that time. So yeah, I think that was great. And then David Lowe, if you wanted to take over to wrap it up.
Maybe I could wrap it up. I wanted, I thought Bronwyn said something that really struck with me, is that, she was mentioning the term that really got to me is this whole issue of violence. And, and then putting that, connecting with memory, is that in the Salton Sea, the project that we're doing is really looking at an ongoing crisis and health impacts. And the particular health impact is in asthma. And if you ever see a kid who's in status asthmaticus or just suffering from an asthma attack, that is a violent experience. And in talking about memory, is that the state and federal agencies too easily forget, because the people who are directly impacted are already forgotten communities. And so it's that notion that by forgetting and not taking action and letting this crisis continue, we are actually doing violence to the kids and the communities that actually have those health impacts. So I think I know it's kind of maybe not the time to put all this together, but the act of the asthma attacks are really a problem of not being able to breathe. So that same is an issue as we saw recently in Minnesota, as well as with the lethal effects of COVID infections. And it's kind of funny to think that, here we are as the Breathe Center talking about this actual impact on just being able to breathe. Anyway, too many coincidences, but it's just really a striking way to think about, for me to think about that sort of thing. And I just love the way all of these discussions in terms of the, historical experience and as well as the way we can bring together all these disciplines to look at these questions from different aspects. And the Salton Sea is just one example, but certainly this goes across so many different areas. So anyway, thanks so much to everybody. This has been really fantastic. I guess Will is going to have this whole recorded event posted so that other people who weren't able to join or stay with us the entire session will be able to watch this later. So
Awesome.
Anything else, Will?
No, I think that's it. Yeah, we'll post the video, and maybe I know Kurt at least had some slides that he wanted to maybe make available. So if the other speakers or Bronwyn, if you had some other materials that you'd like to just kind of attach to that, we can certainly keep the ball rolling. Thank you to all the speakers and Bronwyn as well. It was really enjoyable.
Yeah.
Thank you all.
Thank you all.
Yeah.
Yeah.
Thanks, everybody.
Thanks, David. Thanks, everybody. Thanks, Will. Thanks,
Bye-bye.
Donna. Yeah, bye.